Hi, in today's Medcity's Secret Mantra to OET, I'm going to discuss OET Listening Part A. Well, we know that in listening there are three parts, A, B and C. പക്ഷേ ഈ ഒരു വീഡിയോയിൽ ഞാൻ ലിസ്ണിംഗ് പാർട്ട് എനെ കുറിച്ചാണ് കൂടുതൽ ഫോക്കസ് ചെയ്യാൻ പോകുന്നത്. ഐ എം നോട്ട് വേസ്റ്റിംഗ് എ ലോട്ട് ഓഫ് ടൈം ബിക്കോസ് ഐ നോ ഓൾ ഓഫ് യു ആർ ഈഗർ ടു നോ അബൌട്ട് ഇറ്റ്. ഓഫ് കോഴ്സ് ലൈക്ക് ഓൾ മൈ വീഡിയോസ് ഈ വീഡിയോയിലും ലിസ്ണിംഗ് പാർട്ട് എ സോൾവ് ചെയ്യേണ്ട ടിപ്സ് ഉണ്ടാവും എന്തായാലും. സോ ഡു നോട്ട് ഫർഗെറ്റ് ടു വാച്ച് ടിൽ ദി എൻഡ്. ലെറ്റ്സ് ഗെറ്റ് സ്ട്രേറ്റ് അഹെഡ് വിത്ത് ദി വീഡിയോ. The listening test format. How long is the test? Now listening is the first test that you will attend, the first module that you will attend in your OET. So how long is the test? What is the time duration? 40 minutes. So you have to answer the entire listening in 40 minutes time. And you know what's the most interesting part about the listening test? നിങ്ങൾ ടൈമിനെ കുറിച്ച് വറി ചെയ്യേ വേണ്ട because it is self-timed. As the audio plays, you have to write down the answers, and at the end of the audio clip, you're done with your listening test. അതുകൊണ്ട് തന്നെ time management is not a big issue when it comes to listening test. How many different parts are there in the listening test? 3 parts. You have to answer a total of 42 questions, and each question carries 1 mark. So the parts that you have are part A, part B and part C. So listening part A. എന്തായിരിക്കും നിങ്ങൾ ഈ പാർട്ട് എ എന്ന സെക്ഷനിൽ കേൾക്കാൻ പോകുന്നത്? what kind of audio clips are you going to listen to? You will be listening to 2 patient-led dialogues. And what is the question type that you'll have to answer? It will be a gap fill. Okay. Now let's look at listening part B. You will be listening to 6 dialogues or monologues, and the question type is 3 option multiple choice questions. And listening part C, you're going to listen to 2 long presentations, or it could be interviews, and again the question type will be 3 option multiple choice questions. ഇനി ഈ 3 സെക്ഷൻ്റെ ടൈം എന്താണ്? Let's find out how long each of these sections last. Now listening part A will last for 15 minutes. Listening part B will last for the next 10 minutes, and listening part C will be for another 15 minutes. So this is how it totals up to the 45-minute long OET listening test. ഇനി നമുക്ക് കൂടുതലും ലിസണിംഗ് പാർട്ട് എനെ മാത്രം ഫോക്കസ് ചെയ്ത് പോകും. What is the test format? നമ്മൾ ഓൾറെഡി കണ്ടതുപോലെ you will have to answer 2 patient-led conversations. 15 minutes ആയിരിക്കും നിങ്ങളുടെ total duration of listening part A. ഈ 15 minutes you will have to solve 24 questions. അതായത് 12 questions for the first patient-led conversation, another 12 questions for the next or the second patient-led conversation. And we know it's a gap fill question type. അപ്പോൾ ഈ ഗ്യാപ്സിൽ നമുക്ക് എന്തായിരിക്കും ഫിൽ ചെയ്യേണ്ടി വരിക? We might require to fill a word or it could also be a short phrase. So this is the format of your listening part A. Moving on. എന്താണ് context? നമ്മൾ already പറഞ്ഞു, you will be listening to 2 patient-led conversations. What do you mean by patient-led conversation? അതായത്, a majority of the time you will be listening to the patient's voice. Most of the talking will be done by the patient. Of course, when it is a conversation, who will the patient be talking to? Let's find all that out. എന്താണ് conversation to context? It will be a consultation and the context will always be provided. So before we listen to the audio clip, we have a good idea about what kind of conversation we are going to listen. Let's look at this example here. During this consultation, you will hear a GP talking to Kate Smith, a patient who is returning for her blood tests results. Listen to the consultation and answer the questions. ഇങ്ങനത്തെ ഒരു ഇൻസ്ട്രക്ഷൻ നിങ്ങൾക്ക് കേൾക്കാൻ സാധിക്കും. These instructions will also be written on your question booklet. So you already know it's a consultation. You're going to listen to Kate Smith. So we already have an idea of the gender. And here we are guessing this might be a female. And who is Kate Smith talking to? Her GP, general practitioner. Now that could be a male or a female. പക്ഷെ നിങ്ങൾക്കറിയാം ഏകദേശം 2 ഡിഫറെൻറ്റ് വോയിസ് ആയിരിക്കും നിങ്ങളിവിടെ കേൾക്കാൻ പോകുന്നത്. എന്താണ് ഈ ഒരു കോൺവെർസേഷൻ്റെ ബാക്ക്ഗ്രൗണ്ട്? കോണ്ടെക്സ്റ്റ് എന്താണ്? റിട്ടേണിംഗ് ഫോർ ഹർ ബ്ലഡ് ടെസ്റ്റ് റിസൾട്ട്സ്. സോ വി ക്യാൻ എക്സ്പെക്ട് when we know what the context is, we know the kind of words we're going to listen to, we know the kind of discussion it will be. So there are no surprises in your listening test. Now, here you can see a sample of the question booklet that you find in your OET listening. Like I said, you're going to listen to the instructions. So the context is an interview with a patient called IV Simon. In the question booklet, you will have information provided under headings. Can you see headings here? One heading idana, recent health issues. The other heading is reason for consultation. Patient പേര് നമുക്ക് already അറിയാം, it's IV Simons. So you will have information provided under headings. So we know the first part of the context or the conversation will be about why the patient is visiting. The second part of the conversation will be about the recent health issues. You will also have information given to you to help you keep up with the conversation. എന്താണ് അതിൻ്റെ അർത്ഥം? പേഷ്യൻറ്റിൻ്റെ പേര് നമ്മൾ ഫില്ല് ചെയ്യേണ്ട ആവശ്യമില്ല, ഇറ്റ്സ് ഓൾറെഡി ഗിവൻ. Reason for consultation blank 1. Last visit is some information already given. Did have flu. Information is already given here. Then you have certain blanks. Certain parts are already given. This will help you to keep up or follow the conversation that you're listening to. Let's look at the kind of audio clip. നമ്മൾ ആദ്യം ഡിസ്കസ് ചെയ്ത പോലെ തന്നെ it will be a conversation and it is usually with a doctor or a nurse. അപ്പോൾ നമുക്ക് ഓൾറെഡി അറിയാം ഒരു പേഷ്യൻ്റ് ആയിരിക്കും സംസാരിക്കുന്നത് കൂടുതൽ സമയം. So majority of the conversation will be by the patient and the patient usually will be talking to a doctor or a nurse. If that is one audio clip, the other audio clip could be with another healthcare professional, which means the patient could be talking to maybe a physiotherapist, maybe a dietitian, അങ്ങനെ ആരോടെങ്കിലും ആവാം the next conversation. The conversation is always patient-centered. They will speak majority of the time. So the doctor, the nurse or the allied healthcare professional would be asking questions. അപ്പോൾ ഇവർ questions ചോദിക്കും, അതിനെ ബേസ് ചെയ്തിട്ടുള്ള റെസ്പോൺസ് ആയിരിക്കും പേഷ്യൻ്റ് തരുന്നത്. And the conversation will be focusing more on the patient. And the highlight of your listening is you're going to listen to the recording only once. ഇതുകൊണ്ടാണ് ഞാൻ പറഞ്ഞത് നിങ്ങൾ ടൈം മാനേജ്മെൻറ്റിനെ കുറിച്ച് വറി ചെയ്യേ വേണ്ട. 45 minutes ആണ് OET ലിസ്ണിംഗ് ടെസ്റ്റ് എങ്കിൽ നിങ്ങൾ ആ 45 minutes തന്നെ കംപ്ലീറ്റ് ചെയ്യും. കാരണം the recording will be played only once. You cannot pause, rewind or forward the audio clip. You have no control over the audio that's being played. So in your audio, you will always have a clear idea about the setting. Like it could be a consultation with a doctor or a nurse, or it could be a referral to a specialist. നമ്മൾ നേരത്തെ പറഞ്ഞ പോലെ തന്നെ physiotherapist, dietitian, maybe a dentist or anyone else. Also, the context. It could be describing previous treatment. Sometimes patient അവരുടെ medical history ആവാം explain ചെയ്യുന്നത്. Or it could also be explaining a personal matter. These are just examples. Do not think that the context is only these. These are samples to give you an idea of what kind of context could be given in your OET Listening Part A. Alright, so ഈ കാര്യങ്ങൾ നമുക്ക് കുറച്ച് ഫോക്കസ് ചെയ്യാം. The answers you write are spoken in the audio. So, as we listen, we need to write down the answers. നമുക്ക് ഓഡിയോ കേൾക്കാനും ആൻസർ എഴുതാനും സെപ്പറേറ്റ് ടൈമിംഗ് ഉണ്ടാവില്ല. We need to ensure, so it's more like multitasking. We are writing and we are listening at the same time. There is no change in word form. So നിങ്ങൾ എന്ത് വേർഡ് ആണോ കേൾക്കുന്നത്, you have to fill it in the gaps in the same form. You will not be required to change the form of the word. Minor spellings and grammar mistakes are allowed. So, നിങ്ങളുടെ സ്പെല്ലിംഗിൽ ചെറിയ എറേഴ്സ് ഉണ്ടെങ്കിൽ OET listening does not, or the scores in your OET listening part A will not be affected. പക്ഷേ എപ്പോഴും ഈ minor spelling, what is minor spelling? Minor spelling mistake means, let's say you write a word. You're listening to a word and you need to write down the answer. Some of the written clues might not be the same as the audio. What do you mean by that? Written clues ആണ് നമ്മൾ എഴുതേണ്ട answers അല്ല. Let's look at an example. Now, if this is what you're going to listen to in the audio, I haven't been able to. What do you think you'll find in the question booklet? Has had trouble. Can you see that this is exactly not what is written in the booklet? നിങ്ങൾ കേൾക്കുന്നത് സെയിം ആവണമെന്നില്ല. The written clues, so the information that is already provided, like even 6 months ago. 6 months ago could be said in different ways. 1 year ago could be said in different ways, right? Difficult in the word, it can be said in many other ways. So, in the question booklet, the word might be given as difficult, but in the audio clip, you might listen to the word challenge, challenging. So, you might not be listening to the same as the clues written in your question booklet. What are the steps to follow when solving listening part A? Read the context given, so you know what kind of conversation you're going to listen to. You will know the medical background. എന്തൊക്കെ രീതിയിൽ ഓഡിയോ ആയിരിക്കും നിങ്ങൾ കേൾക്കുന്നത്? Is it going to be two males talking, a male, female, two females? What is the medical background, the context, whether it is a consultation with a doctor, a nurse? You will understand from the context given. Use the headings and information given to help you decide what you listen for. So, if the heading is given as past medical history, you know what you're going to listen for. Take advantage of the time given before the audio starts. So, audio clip you will have some time to prepare, and that's when you need to read through the headings and the information given to you. Look at the gaps and predict what information you're going to listen for. So, if the heading is given as pain, then we know what we can predict the kind of words we might listen to. It could be extreme pain. It could be tingling pain. So, we can predict the answers. Be aware of paraphrasing in the notes, as the audio may be different from the written notes. This is what we discuss. The clues that are given in the question booklet need not be what you're going to listen to in the audio clip. Let's look at the top tips before we wind up today's session. Tip 1. Write as you listen. You do not have a separate time to transfer your answers. നിങ്ങൾ കേൾക്കുന്ന അതേ സമയം തന്നെ നിങ്ങളുടെ ആൻസർ ഷീറ്റിലേക്ക് എഴുതുക. Answers are short. We know it's one word or it could be a phrase. Minor spelling and grammar errors are allowed. Can you see the spelling of grammar here? This is wrong. Pakshe, if I write it as GRAMMAR or if I write it as GRAMMER, both sounds the same when we read it, correct? That is what I mean by minor spelling errors are accepted. Use the heading and the words around the gaps to keep up with the conversation. And the last tip, of course, as always, is practice your listening skills. So I hope this video has given you an insight into OET Listening Part A. I've also shared some tips that you can utilize, and yes, my top tip is always to practice. So good luck with your OET listening, and keep watching our videos for more exciting tips and strategies to solve the different modules of OET. Thank you.